When launched in August 2010, the National Prescription Drug Plan will not only provide major benefits to persons suffering from chronic non-communicable diseases, it is also expected that over time, the plan will create additional business opportunities for existing pharmacies and new entrepreneurs. Algernon Cargill, Director of National Insurance, explained.
There are lots of benefits of pharmacies who decide to join the plan. The primary benefit is that this plan will reach out to 100,000 Bahamians that have one or more of the chronic diseases. So automatically what we see is a spillover of from these people who would normally go to public pharmacies. They now have the option to visit private pharmacies. So this will be new business coming to the pharmacies. In addition to that, we also see that there will be crossover selling. So when these persons come to the pharmacies to fill prescriptions, they'll be able to purchase other items from the pharmacies. But moreover, what we see is we are providing a more convenient way for the persons afflicted with one or more chronic diseases to be able to obtain their prescription drugs. And primarily for this reason, we're very happy that the private pharmacies have decided to join us with launching the National Prescription Drug Plan.
To date, 5 private pharmacies have signed contracts to become providers for the plan at a total of 12 locations. Lowe's Pharmacy will initially introduce the plan through its Soldier Road and Town Center Mall locations, according to CFO William Cash.
Well, Lowe's has been involved in it since its incept, and we've been following it all the way through. We feel it's something that the community needs, and we feel that it's going to take care of the niche that is out there, folk that aren't currently covered, and we intend to give it the support and work with it and try and perfect it as quickly as we can.
Baytande Pharmacy, with 3 locations at the walk-in medical clinics at Sandy Port, Collins Avenue, Carmichael Road, and 2 locations at Robin Hood and West Bay Street, were also among the first to sign on to the plan. Philip Kemp, Managing Director of the walk-in clinic, said the drug plan is a good fit with his company's mission.
The drug program falls along the line of what our mission is, which is to provide health care for the average person. We'd like to be a part of something that forwards that agenda.
Also signing on to the plan were Centerville Pharmacy and the People's Pharmacy. Jonathan Fraser, a partner in the People's Pharmacy, said he feels the National Prescription Drug Plan is a timely initiative.
I think it's long overdue, and our Bahamian people are going to really appreciate it once we can get it up and running. The People's Pharmacy, we're excited, we're very enthusiastic about this plan.
In its first phase, the National Prescription Drug Plan will provide more than 160 prescription drugs and medical supplies free of charge to persons in 4 eligible groups. These include NIB pensioners, NIB invalids, Bahamian citizens over 65 years of age, and children under 18 or under 25 if in full-time education. These persons must be diagnosed by a licensed physician with one or more of the following diseases: arthritis, asthma, breast cancer, diabetes, glaucoma, high cholesterol, hypertension, ischemic heart disease, major depression, prostate cancer, or psychosis. Frances Roberts, Vice President of Centerville Pharmacy on Collins Avenue, said her motivation for joining the National Prescription Drug Plan is to be of service, especially to senior citizens.
I decided to come on board because I thought it was a good thing for the senior citizens. This is the first phase for senior citizens and children, and I think we need to do a service for the senior citizens.
Most of the participating pharmacies expect that the National Prescription Drug Plan will lead to increased business. Robert Sands, president of the People's Pharmacy, anticipates a major impact on his company.
Oh, a huge impact. I think we're going to see a lot of people coming in. I think hopefully we're going to be able to provide a great service.
Philip Kemp of the Walk-In Medical Clinic agreed.
Well, it allows us to improve our customer base, allow us access to customers that we may not normally have access to, persons who rely upon the government to provide for their health care.
As negotiations continue throughout the islands of the Bahamas, it is expected that more pharmacies will become providers for the National Prescription Drug Plan. Meanwhile, registration continues for Phase 1 beneficiaries. Eligible persons may register Mondays through Fridays from 9 a.m. to 4 p.m. at any NIB office in the Bahamas.